of healing. Find out how you can treat your patients virtually now. We are on your side. eMedicine.healthcare, healing you where you are. Begin your virtual practice today. Telemedicine is the future, right now. Across this country and around the world, companies are deciding the future for your patients, who will treat them, and how they will be treated. Shouldn't the future of medicine be decided by those who have committed their lives to the practice of healing? Find out how you can treat your patients virtually now. We are on your side. eMedicine.healthcare, healing you where you are. Begin your virtual practice today. Telemedicine is the future, right now. Across this country and around the world, companies are deciding the future for your patients, who will treat them, and how they will be treated. Shouldn't the future of medicine be decided by those who have committed their lives to the practice of healing? Find out how you can treat your patients virtually now. We are on your side. eMedicine.healthcare, healing you where you are. Begin your virtual practice today. Telemedicine is the future, right now. Across this country and around the world, companies are deciding the future for your patients, who will treat them, and how they will be treated. Shouldn't the future of medicine be decided by those who have committed their lives to the practice of healing? Find out how you can treat your patients virtually now. We are on your side. eMedicine.healthcare, healing you where you are. Begin your virtual practice today. Telemedicine is the future, right now. Across this country and around the world, companies are deciding the future for your patients, who will treat them, and how they will be treated.
Hi, everyone. For the sake of those who've decided to join on time, we're just going to go ahead and jump in, and we'll see how many others show up. Feel free to share your camera or your image or not. That's okay either way. My name's Anthony Boyce. I'm Chief Consultant with CatConnect.com, and eMedicine.healthcare is one of our solutions. This is a first in a series of webinars that we're hosting to provide clinicians with some information on the efficacy and the actual utility of AI and telemedicine in their brick and mortar practices. If you guys could drop a quick thumbs up if you can hear me, so let me know if you can hear me, and then also let me know if you can see my screen. So if you can hear me, okay, great. I see some thumbs up. That's awesome. Thank you for joining us. I see Anton and Patricia and Kevin and Dr. Janelle Bryan. So I appreciate you guys for showing up. We had we actually had a bit of a mix-up. So some people showed up last night. Uh, I guess you could call them exceptionally early as opposed to tonight. So, Lord willing, we'll go ahead and jump in. So we're going to cover a couple things. One, an overview of our actual solution. Then we're going to get into some practice resources to help scale a physical brick and mortar practice beyond the walls and help grow your practice. And then we're going to just do a quick Q&A. And so you'll be able to ask about the solution itself, and then some other tools and things that we offer, or some strategies to help grow your brick and mortar. So I'm just going to share my screen, and we'll go ahead and jump into it. So forgive me if the internet is a little slow. Otherwise, I think we're in a good spot. So let me know by a thumbs up. Also, let me know in the chat if you're a med student, or you're in technology, or you're a practicing physician, or you're just here because you're curious. That's okay. Aaron is with Inova Media. He actually helps with one of the resources we provide physicians, which is we also provide social media marketing and advertising, as well as paid advertising, to help scale your physical brick and mortar practice. And also to help boost your telemedicine practice. So Aaron's going to be helping me moderate. So any questions you drop in the chat. If you can't hear me, or if you want to see a resource again, feel free to just drop it in the chat to Aaron, and Aaron will bring it to my attention. Okay, so without further ado, I'm just going to share my screen. Let me know if you guys can see clearly. Just shoot a thumbs up real quick, and we'll kind of go from there. So how's it looking, Aaron? Can you guys see?
Yeah, I can see.
Okay, awesome. All right, so I'm going to minimize the picture a little bit so I can see. Here we go. Okay. All right, guys. So functionally, eMedicine Healthcare incorporates telemedicine in a very simple, less invasive way. So I know for those of us that are older, got a little bit of gray here. When we think of AI, we think of like Terminator 2, Skynet, some of the pros and cons of, of artificial intelligence. Recently, we've seen, I actually spoke with a clinician earlier today that was talking about a major data breach that took place. And so our goal, or our ambition, has been to incorporate AI in a more usable, more accessible way that doesn't do away with the human component, but actually augments, one, a clinician's ability to practice effectively, but then also two, frees up those human resources, those high value cognitive resources, whether it be your admins, or whether it be RNs, PAs, APNs, to support you in better serving your patients. One way in which we do that is on the front end. So this is the client portal. And what we do is, well, this is a sample portal. You can see it's for primarily elder care or palliative care for patients. You can see here what we've done is sort of duplicate how traditional practice would be branded. So a clinician would have, say, a branded portal for ABC practice, and we would duplicate that branding so it seamlessly reflects your existing branding. So here, well, there's two ways for a patient to book. So they can go to this landing page, whether it be from a cell phone, tablet, or a desktop device, and they can go ahead and two ways to book. So one, they can book manually, so they can just click the book now button, and they're able to schedule a telemedicine appointment and also an in-office visit if you want. And so they can click here, and they can choose from an array of services that your practice may offer. So here we show peds, a regular medication check, wellness check, women's health, and of course a general visit. So if I were the patient, I just click here, and then I can select my staff member. In this case, it's Dr. James Singh. It can be any number of doctors within your practice, even PAs or APNs. And then we have the price of the visit. Now you can choose to bill up front, or you can choose to allow them to book without paying up front and collect at time of the visit in the practice. So I'm just going to confirm my selection here. And then, of course, as a patient, I would see your calendar reflected here. So whatever availability you had in your practice would reflect here in your calendar. So we're going to choose the 19th and choose 11:45 a.m. And then I can just proceed from there to book my visit. Now, that's as far as we're going to go. We're going to see here that there's some forms for me to fill out or a booking form for me to fill out. Now let's jump back a little bit. And that's the first way that a patient can book. That's more manual, as you can see. The second component is with AI. And so we can click here, and of course, the AI is on the back end of the chat button. It'll look like a live attendant in the practice, and I'll say, I want to book an office visit. Now, the upside of this is right now, your practice, or rather a clinician's practice, wouldn't have to expend any additional resources to field this inquiry from a patient. So right now, the patient is completely self-service. Excuse me. So the AI interprets the query, and on the back end, we've done a little training for traditional practice, and it'll say, great, you can book your office visit using this link. So it's now identified that it's an office visit as opposed to a telemedicine visit. And so we're going to click here. Can you all still see my screen? And it should say, you should be able to see that there's a general doctor's visit here, that it's booked. So now we can see now that, I want to be seen, say I want to be seen in office. I want to be seen in office. And so now it's going to say, okay, it saw that I want to book an office visit, but it might have thought that was telemedicine. It may not have necessarily differentiated between office and brick and mortar. So now it's doing a little thinking on the back end, and we've given it that option. All now without having to call the practice, without having to take up the time of a scheduler, physical admin. It's kind of doing that thinking on the back end. 1 second. Ava, welcome. Thank you for joining us. Okay, so I want, oops. So it's interpreting the same query. So let's ask it something else. What is your office? So let's ask it something else. And one thing we've done for the demo is limit the number of queries, because we do get sometimes, completely blown up by demo testers. So I might have to go in on the back end and straighten it out. Okay, so I'm going to cycle this browser real quick. Cycle the browser to reset it, and let's ask it again. Okay. So, of course, this only happens when you're actually going through the webinar. So what? Let's try again. Here we go, guys. Let's try again. Okay. Let's give the internet connection some time to catch up. Okay, cool. So we're going to try again. And what are your thoughts? So the patient can type in their query as usual. We're not taking up any actual office time, which is awesome. Okay, so it just needed a little time for the internet to catch up. So it says our office hours are Monday to Friday, 8 a.m. to 3 p.m. And so I'm going to say I'm feeling really sick. So one of the elements is, say a patient, we don't want any liability for the practice itself. So we might say, if you're experiencing a medical emergency, please contact emergency services. Awesome. I'm okay. Would like to book an office visit. Okay, cool. So I'm going to say I'm feeling okay. I don't need to go to the hospital. I want to go ahead and book an office visit. And so the AI is now interpreting that and choosing from a list of possible options. So it's going to say, okay, cool, you can book your office visit here. Okay, great. So we're going to go ahead and go in like we did before, and we're going to book. And we're going to fill out some documentation. Now, this is an actual digital form. And what we can do is we can take any pre-existing form that the clinician may have in their practice, like your normal intake paperwork, and we can digitize that. Thank you, Patsy, for joining us. So what we're going to do now is look at that intake paperwork. So instead of them having to fill it out and remember to bring it in, or wasting that 5, 10, 15 minutes on the front end, and then your admin having to kind of keep track of that paperwork, what we're going to do is just go ahead and fill it out now. So the patient, all of this is happening before they even interact with the practice. So we're going to choose date of birth, and let's see, let's go to the 80s, 1981, let's say. And going to put in our email and our cell phone. And so this is normal intake information. But the reason we're also putting this in is because this is where we're going to receive the patient's going to receive their automated notifications. So let's just fill this in real quick. Which town? So church. And this can be set up for any country and state and city. So am I a new patient? Obviously, we'll want to know that off the bat, because that's going to differentiate our new patient workflow from our existing patient. So yes, I'm a new patient. So that's going to decide what documentation I get. And what's the reason? I'm sick. Okay, cool. And what are my symptoms? Let's say headache and, whoops, gotta spell that right. And chest pain. Okay, gotcha. And how long have I been experiencing these symptoms? Let's say 6 days. And I know the visit's going to cost $100. And yes, I volunteer to receive care. And yes, I agree to the terms. And I'm not a robot. And I do want to sign and give my consent. So they can do that from their cell phone, or have a touchscreen computer. I'm just touching the screen. You can do this from a tablet. And here they can decide if they're going to pay up front. Or if you do have that capability, if you want us to do that or set up that capability, they can just pay up front. If not, then they can pay when they get to the clinic. And let's see, 12, 8, and 3. And so here, just like that, they're able to, one, receive care, obviously, anywhere they are, where they have a cell phone, desktop, or tablet, so any internet-linked device. And they're able to choose the date and time of their appointment around your schedule. So we're going to protect your time. And then they can go ahead and schedule on a calendar. So here we have a couple options. So we have Google Calendar, Outlook, or iCloud. So we can click on either one. And this is existing, this is from the patient side using existing technology. So they don't have to reinvent the wheel to go ahead and do this. So now we're going to jump into what that looks like for them. So let me just share my screen here, so that you can see it. Okay. And so I am now in my email as the patient. So what happened is I'm receiving some information. So one, I get the invitation to the appointment. So it pops up just like normal in Gmail. Most people nowadays know how to access their email. And I can say, yes, I want to confirm the actual appointment, and it'll do that. When I look at my email now, I see my sick visit right here. So I don't have to learn any new technology or reinvent the wheel to access that information. And now I've got my new patient paperwork that's coming out. Also, I have the appointment confirmation. And then also I have again, my new patient documentation. So this is John, you have new patient documentation. So I think I'll go ahead and sign that. And now I'm now able to pull up the paperwork and go ahead and sign it on my tablet, on my desktop, or on my cell phone without actually ever having to interact with the doctor's office. So we've got a dummy template here. We can duplicate any office paperwork that an existing clinician has. Here we've kind of kept it simple. And so we have, oh, whoops, that's not the right one. That's actually the sign one. So let's go back to old paper. There you go. Consent to treat. Here we go. So let's look at that. Okay. So that's what it looks like after we sign it. Here's what it looks like before we sign it. Okay, cool. So we see here it says start filling out. So I click that to start filling out. I enter my signature, so I can just have it typed or I can draw it again. Okay, my ugly signature. Okay, accept and sign. And then we'll choose today's date, and it's now. And we're going to go ahead and finish. And just like that, the patient is able to fill out their new patient documentation and go ahead and sign in. So what do I do to actually get to this visit? Like, how am I going to access the visit itself? So one, now I get a copy of my receipt.
Sorry to interrupt. We've got a
So I
question
can
here
see,
in the chat.
oh, we do. Okay,
Yep.
cool.
So Kevin is asking, after the patient fills out this form, is the information stored? If so, how is it actually stored, and how would I, as a doctor, be able to utilize this for the future?
Okay, that's awesome. That's actually a really good question. So I'll just finish what I was saying, and then I'll go ahead and address that question. So the cool thing is they get a receipt. So if they are paying up front, they can submit this to insurance for reimbursement. And so when you actually sign the new patient documentation, what happens is or rather when the patient signs the new patient documentation, one, they get an electronic copy, and two, this electronic copy goes to your practice as well. So it can go into your existing EHR. Most have a secure document portal and all a catch-all for documents that the patient would normally have. So if you're still on pen and paper, it'll go into your admin email, and so you can go ahead and print it out, or it'll go directly into your electronic medical record in that catch-all email. Or if you have EDI, which is electronic data interchange, we'll be able to tell. It'll go directly into that secure portal. Let me know if that answered your question. You can give us a thumbs up. If not, I can go into it again. All right. Now on the clinician side, so we can see here from the doctor's perspective, what's happened is, looks like Dylan just jumped in. It looks like from the doctor's perspective, I've gotten a notification that John Test has a scheduled appointment, right? So I can review the request, or I can also see it on my calendar. So I'm going to go ahead and click on John's appointment for 11:45, and I can see his number, I can see his email like I normally would. Gmail, nothing new, not in reinventing the wheel. And if I want to join, I just click here, and obviously I'm in a Zoom meeting right now, and I would be able to jump right in with John, right? And also there's a waiting room function, and Zoom is HIPAA compliant and NPI compliant. It's also GDPR compliant. So these are existing technologies that are well used. Okay, so that's kind of my 2 cents where that is concerned. All right. So one of the things that I'll cover now is, did anyone have any questions on that part? Okay, great. So what I'm going to cover now is something that's kind of near and dear to my heart. So who is telemedicine actually for? Right? So telemedicine and AI. So we talk about the different levels of value. So the 4 levels of value are implementation, which is you're actually doing the thing, and that's typically the lowest level of value. And you'll see, we can use a hotel, for example. The person who makes the absolute least but works the most is the cleaner, is the cleaning staff who does the most work and is least compensated. There's unification, which is management. That's a hotel manager, and they obviously make more. Typically, managers at the high level make 250, maybe 300,000. But when you're managing, they want you to know that they know they own you. So you're making a reasonable amount of money. Now, the highest 2 levels are imagination and communication. So on the communication level, those are your singers, your writers, your authors, your speakers, your actors. Those are the people that can make up to in the millions of dollars. And so we see that as highest value. And then, of course, there's imagination. So those are your visionaries, Bill Gates, Elon Musk, Mark Zuckerberg. These are Steve Jobs. These are the people who envision and create the resources and opportunities that we ourselves use. And so as physicians have been operating in an outdated model, which is it's from the 1950s, a post-depression, largely they're knowledge workers who have been operating in implementation as opposed to along that continuum of professional practice, going from the person that learns, then does, to the person that teaches or leverages that knowledge. And so e-medicine is designed, or telemedicine and AI combined is designed for a clinician to reach beyond their brick and mortar practice to be able to then leverage what they know more than what they do in three ways. So one, to meet patients where they are before they enter the brick and mortar practice, to go from searching for a solution online or seeking help to actually engaging in real time with a clinician, and a clinician being paid for what they know. Two, it allows a clinician to leverage what they know peripherally. So you have new students coming out of school, new clinicians matriculating who may be doing locums. In the States, you have PAs or APNs. And so you have a senior physician who may have learned and then done and is leveraging an existing practice base, an awareness of who they are, reputation, and a sort of arbitrating that or loaning that to these new clinicians to gather additional patients and allow them to be seen in one, a lower risk environment, and then two, triaging them so that they can come into the practice for higher acuity treatment, which is of course more profitable. And of course, three, it allows a clinician to then take a step back. And so say you're billing that same $100 an hour for a telemedicine visit. I just spoke to a clinician earlier who was seeing a hematologist during COVID, and so paid $100 for the visit and then was able to see them remotely. If you have a locums or a less established clinician on the call, a physician, they can take the call. They might make, for that 15 or 20 minute visit, they might bill 100 up front. You make 50 of that, or 25, whichever you like. They keep 50, and if they do 3 of those visits an hour, that's 150 for them, 150 for you. You provide the platform and the resource. And so you're leveraging what you know and your existing reputation rather than that physical hands-on piece. So the question is, who is it for? So it's for you if you think ahead and act while others resist change. Are you an early adopter? Are you someone who's always looking towards the future for bigger and better opportunities to sort of advance your practice and looking towards that legacy component of your career, and or looking to build a new practice or leverage or increase an existing practice? If you value your freedom and desire more opportunities, so do you want to stop trading time for money? Do you want to build a hedge around your time and make it more valuable? Do you want to detach yourself or explore opportunities to increase your profitability while not tying yourself to more time or doing more things? And of course, if you understand and embrace change, if you have an awareness that something is needed and you're willing to do what's necessary to get there. So in Barbados, what I know to be true is, I came here to support my dad. He's getting older in age. He retired 3 years ago, and now he's at that stage where he needs additional care resources with some mental degeneration, etc. And so coming here, I was looking for these resources, scouring the internet, looking on Instagram, things of that sort. And for someone to be that's top of mind for me, and for someone to meet me there, and then have the technology for me to engage at a low risk, very comfortable environment is huge for myself and for him, because I can't get him to go to the doctor. So that's huge. And so now I'm just going to open it up to a live Q&A. If anyone wants to ask any questions, now's the perfect time. And feel free, you can kind of raise your hand and unmute your mic and go ahead and fire. Aaron, if you're paying attention to whomever that might be, feel free to fire away. Any questions?
Uh, what would you say to sorry, good night. What would you
Mhm.
say to somebody who has never dealt with a technology like this before? Well, outside of what you've already said, never dealt with technology like this before. Are having some doubts. What would you really say to them to get them over the line? How could they use it easier? Are there any tips? Um, are there any resources that would come with being able to use it as somebody who's not accustomed to technology?
That's a really good question, Kevin. So I would say we designed this system and this resource with um, for utility and for use with physicians who one don't want to reinvent the wheel in their practice. So your practice comes first. This is designed to and AI and telemedicine, any resource in your practice to fit your practice has to be designed to help you practice better, right? It also has to make you more accessible to your patients. So I would say, independent of my own self-interest, I would say when a clinician is evaluating any resource, and I'm sure they are already, I've dealt with physicians, from when I was in Baylor Healthcare System working in compliance, when I myself was an anesthesia technician working in cardiothoracic anesthesia, when I was working in, home hospice and home healthcare and home infusion. The principal factor is, does this help me do my job better, right? And if so, how? So I think in the case of telemedicine, does it change my practice workflow? I've got a great system going, or I'm, starting off by myself. Is this going to make me jump through more hoops? So I think that's a first thing that a clinician should look at. And I think e-medicine, one, this was derived from when I myself started our giant practice. Well, I say giant, about 250 or so clinicians across 3 states in Texas, Tennessee, and Florida in the United States. And so taking those lessons we learned there and making it more accessible and more usable. So one, the patient does most of the work on the front end, and it's something easy that they understand. I just go to a website, I self-schedule, I pay. It pops up on the practice calendar and the spots that are open. The clinician clicks the button and they join. Super duper simple. So does that take some work off of my plate? Yeah. My admin has less work to do, so she's more available, or he is more available to my needs. And if I'm a sole practitioner starting out, this worked well for me because I don't have an admin. I don't have a workflow, so it's built on best practice. I think also it lowers the barrier for entry. Like I can have my own EHR or electronic medical record, or I don't. So it kind of works both ways. Hopefully that answers your question, Kevin.
Yes, it did. Thank you.
Okay, no problem. Dr. Brian, I know you joined us a bit late. I'm going to put you on the spot. Did you have any questions or anything specific you had in mind when you were joining us today? I know I kind of put Dr. Brian on the spot, so.
Hi, good night. I didn't join late. It was on time. But no, I don't have any questions.
Okay, gotcha. So that's my mistake. You were on time. You think with so few people, I'd get it right. I'm used to a larger roundtable, but Aaron knows I tend to jump in there. Well, thank you. Hopefully, I've answered most of the questions in the presentation. I tried to keep it short and respectful of your time. Anyone else have any questions at all? Like how to access the solution?
Patsy Prusher. I'm retired. I logged
Okay.
in late,
Oh,
but what
that's okay.
I wanted to retired pathologist.
Yes, ma'am.
What about, I don't know if you had dealt with confidentiality. Do you have a separate server to store the data? And can this information be linked to the patient's notes? You have e-notes, I suppose. Or do you, can you give me some more information on that? Just for my general knowledge?
Yes, ma'am, I can. That's actually a really good question, and a question we get quite regularly. Let me make sure I'm jumping into the right, and I'll actually show you the back end where we keep that data. So the first part of your question is all aspects of the platform are both HIPAA compliant, and I'm sure you're familiar with HIPAA, and HPI compliant, which is in Canada, and then also GDPR compliant. So it's all encrypted, and there's third-party authentication. So kind of like when you log into your email and you want to get access, and it says, we've sent a code to your cell phone for you to access it. So it's third-party authentication initially, which is awesome. And then, of course, it has a high level of encryption on the back end as well. And so if in the first instance, if you want to create notes in the system, you can. And it's going super slow. Let me see if I can log in. I do have Zoom on, so that may be why. And I'll show you the back end. So first, you can use our existing platform to enter your notes, or if you have an existing electronic medical record that does have a plugin or an API that allows us to receive text content, we can port that, or we can push that data to you directly. So the short answer is yes, it is HIPAA compliant and GDPR compliant, and then also it's stored on a secure cloud server. And then yes to the second one too. You can also have that in your existing medical record. And that's something we ran into before. And when we first had the larger practice, we had Athena EHR, and we wanted to ensure that we ran into a lot of physicians who said, you know, like, I love my electronic health record. Like, I don't want to change. I don't want to learn something new. So can you send the data? And so we have both options here. And it's asking me to log in with my third-party authentication. So let me see, 39074. Okay, and I'll show you the backend. Okay, gotcha. Excuse me 1 second, and I'll show you the live demo system here on the back end. Okay. Give me 2 seconds. I'm logging in now. And let's pick a patient, John Test. So all the contacts are stored in the system. And I'll show you John Test. Here you go. Can you guys see my screen?
No, can't see it.
Not as yet.
Okay, gotcha. Can you guys see my screen now?
Yes.
Okay, awesome. So there's a couple things to look at here, and the computer's moving a bit slow because we're low on bandwidth. So there's a couple things. One, if you want to make a note, you could kind of make a note here, right? And it's a super basic, super easy to use. You can make a note on John Test right here. If you have a task you just set yourself, or you want to schedule an appointment, or you want to look at any documents that have been uploaded for John Test, you could do that here. If John Test had a phone number in the system, you could just call him using this piece here. So all of that, if you made a note, so like, let's make a test note for John Test. So we can edit an old note. Let's make a new one. So test note for John Test and system. Okay, cool. And there you go. So we got a test note from John Test. It's time stamped, and we know who it was entered by. And of course, the upside is all of this information is accessible. And then we haven't had any previous contact with John Test. Let me see if I can do something here. We don't have, let's put in a phone number and email for John. So let's put in save an email for John. So as soon as we save an email for John, we'll have the capacity to email him. And when we save a phone number, we'll have the capacity to call John. Should pick someone who actually already had it. Let me stop sharing real quick so this will populate faster. Apologies. It takes forever. The system's running a bit slow. I'll pick a contact that already has one. How about that? So you guys can actually see that. You could do it. Contacts. And where is it? Test. There you go. Okay. So I've got a better choice here. Let's use this one. And you guys let me know when you can see my screen. Can you see it now?
Yes, I'm seeing the screen.
Okay. Okay, awesome. So we can see here, we can SMS John if we wanted to. So we can send him a text message like, hi, John. And then we can hit him via WhatsApp. We just have to connect our WhatsApp account. This is a dummy number. It's not a real number. So that's why. And then we can also email him if we needed to, right? So we have all those capabilities here for John Test. So all your communication, and it'll keep a record of any email that I send to him. Test. On the back end. And we can provide, it's a fake email, so that's why. So we can provide as much access or as little access as you want. You don't have to use any of this, or you can use all of this. And you can also restrict, like say you had an admin that you didn't want in the system or something like that, you can use them and you could restrict their access as well. I know that's a bit long-winded, but did that explain, did that kind of answer your question, Dr. Prussia?
Yes, it does. What about hacking? I mean, do you have anything in place to prevent hacking?
Yes, ma'am. So this system is hosted by Amazon Web Services, so AWS. So just as a disclaimer, no system is 100% foolproof. So Google's been hacked before. So any system, you know that Apple's been hacked. Any system that is electronic or digital can be hacked. Anton's a specialist, he could probably tell you about that as well. But the upside is, one, we have third-party authentication, which means there are two separate pieces of access that you would need to have in real time in order to get access. So when I log in, I use my email, and when it asked me for for the code that was sent to my cell phone. So if I were a hacker, I would need access to your email and simultaneous real-time access to your cell phone.
Mm-hmm.
So it's very, very hard to get access to the system, one, and then two, if you did get access to the system, it's encrypted and compartmentalized. So it's not like, depending on the permissions of the user, they're not going to have access to all the data anyways. So nothing's foolproof, but we do take steps to ensure that as much as humanly possible it is.
Okay, thank you.
You're very welcome. Thank you for those awesome questions. Those are actually some really good ones. Can I ask you, Dr. Prussia, what interested you in AI and the telemedicine piece? What brought you to the webinar?
Just continuing medical education.
Awesome. Awesome. Glad to hear you. Never stop learning, right?
Never stop learning.
Yes, ma'am. Okay. Any other questions? Okay. Going once, going twice. Dr. McPherson, anything? Okay, gotcha. Any other questions from anyone at all?
No, please.
Okay, gotcha. All right. So here's what I'm going to do. There's one other thing before we jump off that I wanted to share with everyone. And let me see. Can you guys see my screen? I think I've said that maybe 20 times already. Okay. Okay. So now that we're finishing
Yeah,
up
we can.
So now we're finishing up the Q&A. What we're offering as a limited time offer, we have a case study that we're actually enrolling clinicians in. So we have some clients in the United States. We're looking to add additional users in Barbados. I myself am now permanently based here, which is awesome. Enjoying the sunshine. A little bit of too much heat sometimes, but enjoying it. And so we're enrolling into a user group. So for a limited time, our cost is startup cost is $5,000 for implementation and $497 a month for all features, all included, and that's in Barbadian dollars for anyone who attends one of our webinars. And so, if you have a cell phone, feel free to scan that QR code. It will take you directly to our landing page where you can access that resource. Also, you can reach out to us at offer.emedicine.healthcare. And you'll also have access to that. You'll also be able to book a 10-minute call, just a discovery call to find out other options for streamlining the workflow in your own practice. So if you're thinking about starting up, you're graduating soon, or you have an existing practice, or say, like Dr. Prosha, you're semi-retired and you'd like to get into consultation or anything like that, we can give you some ideas. We've also consulted with larger companies, some Nike subsidiaries in the United States doing hundreds of millions of dollars a year. So we'd love to give you some ideas if you're looking to leverage your what you know and get paid for that rather than what you do. So I'd like to thank everyone for attending our webinar today. It's the first in a series. We'll be putting on about 5 more where we'll get more in depth about how to leverage tools like these with an actual business model. So we're going to talk about collaborative practice, how to set it up, how to recruit clinicians for that, and how to put them in place so that you can leverage, $10,000 to $50,000 a month and more. And we've actually have practical data to support that. And we've done it ourselves in our own previous practice. And so we'd love to show you how to do that and help you grow. So we'll be sending out a replay to everyone who has attended, as well as those that weren't able. Some showed up last night instead of today. And if you have any questions, feel free to reach out to us also at emedicine.healthcare. Thank you all very much for attending.
And thank you for the information.
No problem. No problem. God bless you guys. And if you have any questions, feel free to reach out to us at emedicine.healthcare. Have a good night. Thanks,
Yes,
Aaron. Best moderator in the world.
Did that. All right. Good night, everyone.
All right, bye everybody.
Good night. Good night.